Hi, good afternoon, everyone. Thank you so much for joining us today. My name is Lori Smetanka, and I am the Executive Director of the National Consumer Voice for Quality Long-Term Care. We're thrilled to have you with us this afternoon. The Consumer Voice let me just move on to the next slide very quickly. Hold on one second. There we go. For those of you who aren't as familiar with us, the Consumer Voice is the leading national voice representing consumers and issues related to long-term care. We work to achieve quality care, quality of life, and protection of rights for individuals receiving long-term care and services. We do that by advocating for public policies that are responsive to consumers' needs, empowering and educating consumers and families with the information and tools they need to advocate for themselves. We train and support those who advocate for long-term care consumers, and we promote the critical role of direct care workers and best practices in the delivery of care. So we're really glad to have you with us today. A few reminders as we get started. You heard at the beginning of the broadcast that this webinar is being recorded. The recording and slides, along with other resources that will be mentioned today, will be posted on our website at www.theconsumervoice.org. We do ask that you use the Q&A feature on your control panels to ask questions that you may have, and you can use the chat feature to make any comments. You'll also find a link to the PowerPoint in the chat box. So when we began planning today's program, we were thinking about the fact that we're approaching the 2-year anniversary of the COVID pandemic. We were thinking of the 200,000 residents and staff of long-term care facilities that have been lost due to COVID, and the countless others, more than tens of thousands, who suffered from isolation and neglect during the pandemic. As you know, much of the devastation that we've seen in long-term care facilities has been the result of long-standing problems that predate the pandemic. Issues like inadequate staffing, lax oversight, and lack of accountability for meeting quality standards and for how providers use the billions of taxpayer dollars that they receive. We at the Consumer Voice have worked with so many of you, not just during the pandemic, but for years, advocating with Congress, with administrations and federal agencies, and with state policymakers to raise the voices of residents, to advocate for quality of care and quality of life, for better pay and working conditions for staff, and for accountability of providers. And it seemed like the 2nd-year marker of the pandemic was a good opportunity to refocus our work and our advocacy on these important issues, and to share strategies for moving forward with our administrative and our legislative advocacy. So we were planning the webinar, and then at the beginning of this week, like you, we were especially thrilled to get the news that President Biden was announcing a set of reforms to improve quality and accountability in nursing homes. These are a strong set of reforms that will make a real difference in the lives of nursing home residents, and they are the boldest proposals that we've seen in decades. So while we're sure that you've all read the fact sheet that's been released by the White House earlier this week, we think it's always helpful to go through it and hear more about what's included in the plan, as well as how it will be implemented. So we are delighted to be able to have with us today Will Harris, who is a senior advisor in the Office of the Administrator at the Centers for Medicare and Medicaid Services. Will has been with CMS since January of 2015 and has worked on the Hill and on the Senate side prior to that. He's originally from Louisiana, and he went to LSU and LSU Law Center. And Will, I'm going to turn it over to you to talk about the President's Plan. Thanks for being with us today.
Thank you very much, Lori, and thanks to everybody for being with us. I do want to start by thanking you, Lori, for your partnership on this effort, and Consumer Voice as a whole for being a partner with CMS and helping us to get the kind of stakeholder feedback that our administrator has made it clear is so important to integrating into our policymaking. So
thank you so much. We're thrilled to be working with you.
Yep. So thank you for that. Again, thanks everybody for being here. I'm very glad to be with you to talk a little bit about the President's plan here and a little bit about some of the announcements that were made earlier this week. At CMS, we know that the time is now to tackle the crisis in America's nursing homes. That's why the President outlined CMS's bold vision and strategy about our moral responsibility to improve conditions for nursing home residents and staff. The nursing home industry is at an inflection point. The COVID-19 pandemic really highlighted and exacerbated the challenges that we've seen in nursing homes for too long. And that was one of the catalysts for making sure that we put out a bold new vision for the administration to work on improving the safety and quality of care at our nation's nursing homes. I mentioned that COVID-19 adversely affected nursing homes in a particularly hard way, but it's worth spending a little bit of time on that to really, obviously you all know this, but to really point out just how dramatic that was. Over 200,000 nursing home residents and staff have lost their lives. That makes up about a quarter of all or a little more of the COVID-19 deaths in this country. As Lori mentioned earlier, residents experienced isolation and disruptions in care because of the pandemic and how it exacerbated the longstanding problems that I was mentioning before. Just as important, the frontline staff at the nation's nursing homes have been feeling the pressures of their jobs at new levels. And I do want to in particular call out that without the hard work of that frontline staff, we know the number of deaths from COVID-19 would be higher and would be even more staggering. So all of us at CMS, I want to pass on, especially from our administrator, Chiquita Brooks-LaSure, are deeply grateful to the nursing home staff who are doing this kind of work every day. Talking to those staff, along with nursing home residents, the industry experts and other stakeholders, was critical to the development of this plan, and it will continue to be critical as we look to implement it. We know that we can accomplish the items and the tasks in this plan in part because of the great input that we've received during its development. It's an ambitious plan, but we know that we can do it. There are 5 pillars of how we're going to do this, as you saw in the president's fact sheet: strengthening nursing home staffing, improving the quality of care in nursing homes, enhancing accountability and oversight, protecting resident safety and dignity, and increasing transparency. The heart of this vision really is establishing minimum standards for staffing in nursing homes. Minimum staffing standards will further encourage facilities to pay a living wage with competitive benefits and provide opportunities for advancement. CMS has long identified staffing as a vital component of a nursing home's ability to provide quality care. The COVID-19 pandemic highlighted the importance of staffing for the well-being of residents. Staffing in nursing homes has a substantial impact on the quality of care and the outcomes that residents experience. And we also think that staffing standards need to look at staff turnover. It's a really important element. We're exploring the relationship between staff turnover and quality of care. And a preliminary analysis indicates that as the average staff turnover decreases, the overall quality of care provided increases, suggesting that lower staff turnover is associated with higher overall quality. We developed these in partnership with others. This plan was developed in partnership with stakeholders. And I want to make that very clear. I don't think it can be stated enough that, in the strategic pillars that our administrator announced at the beginning of her tenure at CMS, one of those 6 pillars is integrating stakeholder feedback into policymaking. And we take that very seriously through listening sessions, through meeting with stakeholders. Literally, the conversations that she has had with nursing home residents help to inform this vision. I want to make sure that's really clear. And I also want to be clear that these actions and this initiative is going to be carefully coordinated alongside CMS's other effort to ensure that people can access long-term care in the most appropriate setting that they want, including through home and community-based services. Overall, we recognize that any kind of meaningful change in this space is going to require partnerships with many people, including experts, including nursing home residents, nursing home staff, family of residents, people like you. And we're going to be looking to hear from you and others as we work to implement this plan, as we work to further develop it. And that's exactly the kind of reason that I'm here today with you to hear about the kind of findings that you're making and the focus that you have. And I'm really interested to hear more about that. But overall, we know that we need to partner with stakeholders in this engagement. That also includes partnering with Congress. The president's plan that he put out on Monday includes several asks of Congress, and it is just as important that that Congress acts so that together we can be partners to enhance the safety and quality of care in the nation's nursing homes. I'm really looking forward to continuing to engage with you and with others and your networks. We want to be plugged into the work that you're already doing as far as the studies and research that you're engaged on and the particular focus areas that you're seeing on the ground. I know I've said it 3 or 4 times already, but our administrator challenges us every day to make sure that we are incorporating people's lived experience into our policymaking. And that's why we are focusing on engagement like this and like we'll be doing with others. And really appreciate the time that I have with you today. Appreciate Lori's invitation and hope that I haven't rambled for too long. So thank you all very much and appreciate you having me. Thanks, Lori.
Thanks so much, Will. As I mentioned, these are the boldest set of reforms that we have seen in a decade, and we absolutely want to share our thanks with not only you and Christiana Yao, who's with us today on the staff, but to President Biden and Secretary Becerra and Administrator Brooks LaSure and all of the team that's been working with you all on this to help craft this plan. We know it'll make a difference for residents, and we do look forward to hearing more about the implementation and to working with you all in order to get these provisions put into place to make a difference for residents. We know that you have planned a stakeholder call for next week that has been announced by eBlast, where hopefully folks will hear more about plans as well. And here at the Consumer Voice, we will continue to be sharing information with you as we get it, along with the strategies that we'll be using to work with CMS and with our advocacy partners to implement parts of these plans as well. So thank you so much. Absolutely.
Thank you, Lori. And I'm not leaving. I'll stick around so I can hear the rest of the meeting too. So thank you. Appreciate you having me.
Thank you very much. So, you know, the critical nature of the proposals from the Biden administration is made evident when seeing the impact on residents who do not receive the care and services that they need and to which they are entitled under federal law. And this week, the Consumer Voice released a new report that looked at federal data around resident outcomes and conditions that we really think highlights the need for the reforms that have been proposed, particularly the implementation of a federal staffing standard. And this is part of our March 4th agenda to start sharing with you the resources that are available, the data that's available, and we'll be using this in our advocacy as well. We know that you will also, and we wanted to share this new report with you because we think it's a critical part of the messaging that we will be sending over the coming months as we are all advocating for improved conditions. So I would like to turn things over to Sam Brooks, who is our manager for policy and program at the Consumer Voice, and he's going to share more information about our new report. Sam?
Great, thanks, Lori. And thanks, Will. Just really honored to have you here and just really excited about the developments this week. As Lori indicated, we were going to have this webinar, this no matter what, and then and part of the focus of the webinar was going to be this report that that we have done and we're releasing. So at the last minute, and it's a good thing, we had to make changes to reflect that on Monday, the Biden administration made this announcement that a minimum staffing standard was going to be in place. So that was a last minute edit to this report. For most of you who are familiar with Consumer Voice, we've been really trying since the beginning of the pandemic to get out reports and information that is helpful to residents, families, and consumers. And this report, again, focuses on really how devastating COVID was on nursing homes, and what probably the most primary driver of that was inadequate staffing. And so today we're going to talk about this report, and I'll show you the link at the end. And what this does is it looks at more data. The Consumer Voice knew pretty early on, once visitation continued to be locked down and families continued to be alienated from their loved ones, that it was going to be, there's going to be another pandemic, a pandemic of isolation and neglect. And we really tried to start ringing that siren as soon as possible as the pandemic dragged on. And we last year we had issued a report that talked to family members who had been reunited with their loved ones after these long separations. And I'll go over some of the statistics in the next slide, but really what we heard confirmed what was just intuitive to us, that residents suffered. And they suffered not only because there weren't family members there, but because there wasn't staff. And we all know that staff made up, family members made up an unpaid staff. Family members were in there either because they wanted to or because they had to, providing personal care. And they supplemented a lot of staffing shortages across the country. And when family members were locked out, we saw just really what happened. The pre-existing staffing shortages that Will talked about and Lori talked about were just exacerbated. So some of these numbers here in our January report of last year just show 85% of families noted a decline in physical abilities and 87% in physical appearance, 91% in decline in mental status, and almost 7 out of 10 respondents indicated the facility did not have adequate staff. And with these came just, it was amazing how uniform a lot of the comments were in the survey. My mother's hair hadn't been washed in months. My father's had been in his room without his teeth, without his glasses. He lost 30 pounds, 40 pounds. The room was dirty. Just these horrific, horrible stories that were neglect and abuse. And they were the result of not having enough staff and not having families in there. And so we issued this report. Next slide, please. Oh, back here. And for family members on the call or advocates, ombudsman, they were seeing these things too as they started to go back into nursing homes. So we took a look at federally available data, MDS data. MDS data is, it stands for minimum data set, and it is information that is required to be submitted by nursing homes to the federal government. And there's a variety of measures. There's dozens of measures for residents, including diagnoses, weight loss, weight gain, medications, falls, just a myriad of things that the federal government relies on to gauge what is going on in nursing homes. And then this data is shared publicly. So we took a look at the data. The currently available data now is only available up through the second quarter of 2021. But the data matches what we have seen and what we knew was happening. And for family members on the call, a lot of these these peaks in adverse events such as pressure ulcers, depression, correspond when facilities were locked down. You see them start to level off or even drop as families are reunited with their loved ones. Currently, I saw there was an article the other day that said almost 90% of facilities are experiencing shortages. Currently, about 30% of facilities are reporting staff shortages right now. Fortunately, families are back and they're able to supplement that, but that's not a solution. The solution is what Will talked about and what was announced by the president today. So we're just going to go through some of this information, this data that we looked at. Next slide, please. Whoop. So this is a graph of pressure ulcers, percentage of residents with pressure ulcers, and pressure ulcers are also often called bed sores. And these are the result of residents who are often bedridden, and they lie in bed most of the day due to mobility issues or other issues. And if they're not repositioned, they can develop pressure ulcers, and there's different stages of ulcers, but they can be deadly. They can become infected and often become septic, and really can be a threat to a resident's life. And they're also a sign of neglect. Residents need to be repositioned. If they're not able to get out of bed, staff needs to be repositioning them. So you see in this chart here, and I'm sorry, for some reason the quarters got, the dates got taken off, and there's numbers now, but you can see through this chart how it's at 7.5, and then it starts to rise significantly once the pandemic begins, and once visitations locked out, and there's just not enough staff there to reposition residents. And it peaks here. It goes from really a low of 7% to 9% in I think it's the first quarter. I'm sorry, the quarters are off here, of 2020. But you start to see it come down again once families are reunited. Next slide, please. There are my quarters again. So this talks about weight loss, and all of these charts you're going to see are going to follow a similar type of pattern, where you have certainly inexcusable numbers prior to the pandemic. We believe weight loss, those numbers were inexcusable, but as the pandemic comes, you see them go off the charts. So in the first quarter of 2020, about 5.85% of residents had experienced weight loss of 5% or more in the last month, or more in the last month, or 10% in the last 6 months. But you see that rocket up into over 8% in the third quarter of 2020. And this, what I want to highlight is that is when facilities started to reopen, visitations started to reopen, and you start to see the drop. And this coincides with when family members are being reunited with their loved ones. But what you're seeing before that is what happens when there's inadequate staffing, is that many residents need to be fed, many residents have diet restrictions, and if you don't have adequate staff, you're going to see some of these really drastic numbers. It was also reflected, as I said, in our report. Next slide, please. Our earlier report. Depression. Percentage of residents reporting depressive symptoms. And frankly, I'm surprised this isn't higher, and it probably is, because this is facility reported data. But if you look, you have this huge peak that begins when facilities lock down. And this is when we're starting to hear stories of, my mom is alone in her room. She doesn't know how to use her phone, or the phone is broken, it's lost, and they're isolated away from their family members. And then they're not getting any type of care, or they're not getting sufficient care. And it's not surprising that you see this whole really extreme rise in percentage of residents with depression symptoms. Next slide, please. And this is one that we find particularly troubling. All of them are troubling. But if you look really at the first quarter of 2020 there's a huge jump in the percentage of residents receiving antipsychotics in the prior week. And what that often indicates is that facilities, unfortunately for decades, facilities have inappropriately used antipsychotics to sedate residents. It's called chemical restraints, to make up for inadequate staffing, to make up for investing in proper treatment for people that may have symptoms or behaviors that require more care. Many facilities, unfortunately, will sedate them. And so you see, and it's illegal. CMS has tried to focus on this. About 10 years ago, they started focusing on this, and hopefully, with this new initiative, we're going to start to see this number go down. But there's just this high jump in the percentage of residents receiving antipsychotics, and it coincides right when the facilities locked down and families left. Next slide. And there's also a corresponding jump with the percentage of residents with a schizophrenia diagnosis. Unfortunately, schizophrenia diagnosis sometimes are used by facilities to hide the inappropriate use of antipsychotic medication. I think in the report, in the New York Times reported that 1 in 150 people in the general population have schizophrenia, while in nursing homes it's 1 in 9. And most of those are just bunk. I think the quote was bunk diagnoses. But how this often is used is to disguise the use of antipsychotics. There's a measure that is used and that excludes people getting antipsychotics if they have a diagnosis of schizophrenia. So either a bunch of people checked in right in the second quarter with schizophrenia, or developed schizophrenia in the second quarter of 2020, or something else was really going on. Unfortunately, I think we know what that is. Schizophrenia doesn't develop when you're 80 or 70 or 60. It develops generally in your 20s. These aren't the types of conditions that are contagious or you get when you're older. So next slide. You can read both reports. I've mumbled on long enough here, but the most recent report, the link is here. And I also encourage you to look at the second report, which we released last year. Again, we were releasing this report to try to gain initiative to address inadequate staffing and the creation of a minimum staffing standard. So Will kind of stole our glory, but that's a good thing. I'm really glad to be here on a day where a lot of these issues, a lot of this neglect, and a lot of these measures would not have occurred if there was adequate staffing. And so I'm going to turn it over now to Jocelyn.
Thanks, Sam. I'm Jocelyn Bogdan, Senior Policy Specialist at Consumer Voice. And so as we enter another March, the third pandemic March, we wanted to take the opportunity to use the anniversary, and I know none of us really like that word, but to use it to highlight and draw attention to the way these last 2 years have really shone a light on the importance of nursing home reform. You already know, and Will and Lori both referenced earlier, that over 200,000 residents and staff died during the pandemic, and that so many others have suffered, and that there were residents who died from isolation and neglect. The report and data that Sam just discussed went through the catastrophic effects of understaffing during the pandemic. But everyone on this call knows, and as Sam pointed out, this issue and other issues facing nursing home residents, it didn't start with the pandemic. These are longstanding issues that the pandemic exacerbated and drew attention to. And that's why, again, we were all so happy to hear about the Biden administration's plan for bold nursing home reforms that are so desperately needed. And we are so grateful to be working today with CMS, and grateful that Will was here to outline some of this for us. But This is the very beginning of change, and there is a lot of work to be done in the coming months. There's already pushback from the industry, and we need to get out there and explain why these reforms are so necessary. And so at Consumer Voice, we wanted to use March as a month of action. Next week, and in the coming weeks, we'll be sending emails that dig more into all of the actions we have planned, but I wanted to give everyone here today an overview. Next slide, please. Okay, so our first week, March 7th through 11th, is a week to celebrate. We really want to get letters out to the administration thanking them for this new plan. Nursing home reform has been a long time coming, and it has taken a lot of effort to get ourselves where we suddenly found ourselves this week. We know it can be a lot to ask every one of you to write your own thank you letter. By all means, feel free to do that if you can. But Consumer Voice has written a letter that will be available on our website next week to send directly to the White House. Frankly, we're excited to thank the administration, but we also want as many people as possible to send these letters to show just how much support there is for all of this. So look for an email early next week with more details. And please don't just click the link and send the letter, but forward the email to your friends, to people who might not be part of this network, but might have a loved one facing long-term care in the near future, or might be thinking about their own futures. These reforms mean so much to so many people, and there might be people that you know who don't even realize what's happening with this issue. So spread the word. Next slide, please. As I mentioned before, it's really important for all of us to focus on why these reforms are so necessary. And that's why Consumer Voice is launching a new letter to the editor tool. The week of March 14th, look for an email launching this and giving everyone information on how to craft a strong letter to the editor. We're encouraging as many people as possible to write these letters and send them to their local media publications. This is a great opportunity to go on record and put your voice out there. And we'll have lots of suggestions and advice on how to do this. Next slide. The following week, March 21st to 25th, is Social Media Week. And let's be honest, in some ways, every week is Social Media Week. Social media has become so important in our everyday lives. And we've seen during the pandemic how it's helped residents and families connect and organize. We've seen groups spring up like Caregivers for Compromise. And we've seen family councils at facilities use Facebook to connect when the pandemic kept people apart. And at Consumer Voice, we're going to be making a big push on social media all month. And we would love for all of you to do the same. But we wanted 1 week to really highlight resident and family voices on social media. So let me just take a minute to talk a little bit about this. When it comes to who's most impacted and affected by staffing and ownership and transparency in nursing homes, it's residents. And we want to make sure that their voices are heard and their experiences are shared. We'll be sharing video clips at Consumer Voice all month of residents themselves speaking about issues like understaffing and how it impacts their daily lives. We'll also be sharing videos of family members discussing what their loved ones' experiences have been. And this week, starting March 21st, we want all of you to join us. We're encouraging everyone who has a loved one in a nursing home who can to visit and make a short video. It can be 30 seconds, it can be 2 minutes, asking your resident, what does it mean to them when there aren't enough staff? Capturing their answers and sharing the videos on Twitter and Facebook. Family members can make videos too of themselves answering the same question. We'll be posting on Facebook and Twitter with 2 hashtags, March 4th with residents and understaffing is neglect. We'll also be sending out suggestions for different tweets and posts. But videos and residents' voices are so powerful, and we'd love to generate as many as we can. We'll be having new conversations with residents and families in the next few weeks and posting those clips as well. And so again, feel free to use social media whenever you can, but with a real focus on Social Media Week. And even more than that, on March 24th, which is that Thursday, we're going to be having a Twitter storm. Using the hashtags mentioned above, we want to flood Twitter with messages about the importance of nursing home reform. And we would love for everyone to post their videos that day. This is a great way to send a powerful message with residents at the forefront and to empower residents to speak on their own behalf. And as the hashtag says, March 4th with residents. Next slide. The final week of March, which dips into very early April, is a week to reach out to Congress. The nursing home plan set out by the Biden administration is a huge victory. It is a huge step forward. We're not done. We need to see these reforms implemented, and we're not ready to stop here. And as Will mentioned earlier, Congress is a big part of this plan. It's so important to make sure Congress stays engaged on these issues and doesn't feel like the battle's been won. So as March ends, we have to keep pushing. We're so excited to have everyone engaged throughout the month. We know you might not have time to do everything, but try. This is our chance to move something great forward and to really make positive change for nursing home residents. Let's take advantage of it and march forth together. And with that, I'm going to turn things over to Robin.
Thank you so much, Jocelyn. I'm Robin Grant, Director of Public Policy and Advocacy at Consumer Voice. In addition to thanking the President and CMS, all of us at Consumer Voice want to take a moment to give special thanks to every one of you who've been working tirelessly for nursing home reform and share with you our deep gratitude and appreciation. Your tenacious and persistent advocacy, day after day, month after month, and frankly, year after year, has brought us to this point. By making your voices heard through your stories, your emails, your calls, your signatures on letters, you have made a difference. There is no way we would be looking at this comprehensive set of reforms without your efforts. You know, since Monday, I've been reflecting on how really momentous the administration's proposed actions truly are. On a very personal note, I've been advocating for nursing home residents for 32 years, and for 32 years, I've advocated unsuccessfully for a minimum staffing standard. Now, for the very first time ever, not only is there an administration that's supporting a minimum staffing standard, but it's actively calling for it. This is a really big deal. And frankly, really frankly, I never thought I'd live to see this day. So it is truly momentous. So to all of you, thank you. Thank you, thank you. You have all played a major role in getting us to this place where we now have a real opportunity to transform the lives of residents. You are the best. So take a moment to be proud of what you've done. Pat yourself on the back, do the happy dance, celebrate. And then let's all join together to take this over the finish line so residents can be the winners. And with that, I'm going to turn things back over to Lori.
Thanks so much, Robin, Sam, and Jocelyn for leading us through these different parts of the agenda today. And if the three of you want to come back on, we'll move to answering some of the questions. We know that there's a lot that we still need to learn about the implementation of the plan from the White House. And as I mentioned to you earlier, as we continue to get information from them, we'll be sharing it with all of you so that we all can stay informed about what the implementation plans are, looking at their timelines for implementation of these different pieces and what we can do to be supportive and to help all of that. We've been watching the questions and the chat. And, you know, there are a few points that I wanted to address as we're starting to look at questions, and we'll answer some of them today, and we'll gather some of them and share them with CMS so that they hopefully can respond to them as well. But, you know, there are a few people making points about not only are the results and the outcomes that we saw in the report that Sam talked about a result of short staff, but a result of the families not being in facilities to help support their loved ones, ombudsman not being in facilities to help with complaints and keeping an eye on what's happening in facilities and providing support to residents and families, and also surveyors not being in there. It all came together and was collective, but with those other pieces, with families not being there, with ombudsmen and surveyors not being there, it really emphasized how short-staffed a number of these facilities were. And we know that that has just been really exacerbated throughout the pandemic as staff themselves were getting sick and not able to work and leaving for a variety of reasons. But it really showed how important staffing is and the staffing crisis is, and how important it is to have other eyes in the facility, family members and ombudsmen and surveyors, and how critical they are in terms of being there and ensuring that there's quality care. There also were a few comments about the needing to be able to have choice in where people receive services and taking your loved ones home. And we absolutely agree with you. We are actively advocating for expansion of home and community-based services and supports for people to have choice in where they receive services, and we will continue to do that. But we also know that there are people today living in long-term care facilities that need our help, and there will always be a need for congregate care settings. And those people also need to be living in settings where they're getting absolute quality care and services. And then the other point that I wanted to mention that we all just know is that so many residents don't receive visitors. They don't have family that are coming in and advocating on their behalf. And we know that those of you who are in there visiting your families also are great advocates for the other residents that are living in those facilities. Ombudsmen are there, and surveyors are there, paying attention to what's going on for all residents and are advocating for everyone. And so that again just reinforces how critical it is to have all of these outside eyes in facilities, not only monitoring care, but being supportive of the residents and families and the staff that are living and working there. So with that, we want to turn to some of the questions that were posted. And one that we get asked all the time, and I'll start and then I'll ask the other team members from the Consumer Voice to pick questions that maybe we can read and start answering, is do the proposals that we're talking about through the White House, do they apply just to nursing homes or to other settings like assisted living and memory care homes? And again, these proposals are specific to nursing homes, and nursing homes are certified by Medicare and Medicaid, and the federal government is responsible for overseeing that. And so that's why when you hear things coming out from CMS, it applies to nursing homes directly. Assisted living and those types of facilities are regulated by the state. And so we look to state standards for those, but there are things that the federal government is doing to expand home and community-based services. And there are different provisions that they are looking at to determine how they can also help improve care and access to other settings. So, but these specific provisions apply to nursing homes. So Sam, Jocelyn, or Robin, can you pick another question and throw it out, and we can do our best to start looking at how we can answer some of them?
I saw one, and I'm gonna kind of put Robin on the spot, but there was a question, but it's more of a kudos to Robin. It was a question about there's a bill in Tallahassee, Florida, to actually reduce staffing hours, and would this would President Biden's minimum staffing standard address that? And I thought, with your report recently, Robin, on the state staffing standards, and it just highlights the need for a federal standard. So I didn't know if you wanted to just talk about what your report found.
Sure, thank you, Sam. So we did look at the state staffing requirements across the country, and particularly how they compare to each other, but also how they compare to the recommended levels of 4.1 hours per resident per day. And we were truly disturbed to find that it's not even the state, but it's the District of Columbia was the only place that actually meets that standard, both in terms of the 4.1 and also in terms of having a registered nurse around the clock. So that just really underscores the importance of having a federal minimum staffing standard, because we are so far from getting anywhere at the state level, and certainly it's very onerous to try to do it state by state. So in answer to this particular question, the federal minimum staffing standard would apply to all Medicaid and or Medicare certified facilities. So it would trump, if you will, the state staffing standard. So the facilities in Florida would have to follow the federal staffing standard and not the state staffing standard, assuming it's higher.
Great, thanks, Robin. Sam, you said you had another one ready to go?
Well, there was a lot of question about what needs to be done legislatively and what can be done through regulation and administrative action through CMS and Will and Christiana's agencies. But there's also the fact that there was also a question about the Build Back Better Act, and the Build Back Better Act is still out there, and it still contains, although it's stagnant right now, it was passed in the House, and it contains some significant investments in nursing homes. And this also goes to other concerns about, well, how are they going to get staff? There was billions of dollars in there to invest in staff, both in training, increasing wages, increasing benefits, sick leave, and paying staff certainly the wages that they're worth. And there's still other bills out there. The Nursing Home Improvement Accountability Act also has provisions that would achieve some, maybe not all, of the president's goals, but are certainly out there already. I can't speak to everything that can be done legislatively and can be done through regulation, but that is why we're asking you at the end of this month to make your voice heard to your Congress people. There are provisions that would increase funding for enforcement, increase funding for staffing in the Build Back Better Act. So we have that opportunity as well. Will, you came back on. Yeah, I don't know if you wanted to say something, Will. You came back on the screen, or am I?
I did. I'm going to get myself in trouble and answer a question. I'm sorry, but I couldn't help myself about it. Thank you for teeing that up, Sam, and for highlighting that. And I did want to talk to a couple of the different things that I saw questions about too, particularly around staff availability and also around getting care where it's most appropriate for you. I did mention that in my remarks, but I wanted to make sure to highlight it, like as Lori just did. First of all, if you haven't read the whole fact sheet that the president put on White House website, definitely encourage you to do so. It is, I would call it, a holistic plan to look at staffing overall, and does address things like affordability of training, as well as hoping to partner with other parts of the government to do a campaign on nursing careers, to help to encourage recruitment for new nurses and direct care staff. So that is something that we want to look at really carefully and work hard on. And also, I mentioned this at the top, but did want to reiterate that, you know, CMS and other parts of the Department of Health and Human Services are working on increasing resources for home and community-based services, that, you know, we certainly want to see people get care in the setting that is the most appropriate for them. That is certainly part of our focus. And obviously, we think there's a lot of work to be done on increasing the quality of care and the safety in the nation's nursing homes, but that certainly shouldn't take away from the fact that we want to work on that as well, about making sure you get care in the most appropriate setting. So thank you. Sorry for butting back in.
No, thank you, Will. Jocelyn, did you have a point to make?
Yeah, I was just going to jump on what the end of what Sam was saying. Somebody asked in the chat, if the industry is already pushing back, why are we waiting until the end of March to lobby Congress? And so first, just to give you a little background on the inner workings at Consumer Voice, you know, we sat down and we've been planning to have a month of action during March since before this plan dropped. And this week, we sort of recrafted how we wanted to do things. And so first, as Sam mentioned, if we see Build Back Better start to move or parts of it start to move, that's likely going to happen in April. And so, or after April we wanted to wait to make our push until closer to that time. We also know that parts of this plan, as well as mentioned, do involve Congress. And we want to make sure, when you do something like this, like the letter that we're writing to the president, all of these things, we're going to have one ask of Congress. And we want to make sure it is the right ask and we have everyone on the same page. So we're putting that to the end of the month so that we can have a strong effort when it comes to that. And in terms of the industry pushing back, I do really want to emphasize that reaching out to local media through letters to the editor is a great way to respond to that. Having tweets and using social media is another great way to respond to that. So thankfully, our push to Congress is not the only thing that's going to respond to the industry, but we actually sat down and thought about what makes the most sense as we go week by week. And I think it was actually yesterday that we decided to move Congress based on those reasons. So that just gives you a little background into our inner workings.
Yeah, and I think I would add to what Jocelyn said, and while we're having specific weeks devoted to some of these specific actions, we want to just remind you, as you all know, because you've heard us say how long we've been doing this work. Robin's been doing it, she said, for 32 years. I've been doing it for almost 30 years. A lot of us have been working for a long time. These issues are going to, and getting this over the finish line is going to take a lot of effort. These are not going to be one and done letters, one call, one email. We're going to have to be consistently contacting our members of Congress. We're going to have to consistently be providing support and really speaking out on an ongoing basis about what it is that we want to have happen and we want this plan implemented. And so you are going to be seeing, not just during the month of March, but over the coming months, you're going to be seeing a lot of requests for action from us at the Consumer Voice and from our advocacy partners to ask you to do things to raise your voices and raise the experience of residents in order to provide support for these provisions. And it's really, really critical that you do that whenever you can, so that your members of Congress, your policymakers, CMS, the White House, all see how important this is, that we actually get this plan implemented. So we really do thank you for all the work that you have done in the past. Again, as Jocelyn mentioned and Robin mentioned, the work that you did last year in response to the advocacy requests around Build Back Better really made a huge difference. The messages that all of you were sending out to CMS and your state survey agencies and to your policymakers at the state and national level have made huge differences in raising awareness of all of these issues, but we're not done yet. We need to keep going, and we're going to be needing to do a lot more in the coming months. So I think we have time for maybe one or two more questions. So does another one have one queued up that we can ask?
I could talk. There's a question about private equity ownership and what is the plan for combating private equity ownership. And I can't certainly speak to what the administration's plan is, but at Consumer Voice, our main call has been recently and going forward is for transparency and how all Medicare and Medicaid dollars are spent. Currently, how the nursing home industry, not just private equity, but the majority of nursing homes structure their ownership, it's hard to see where the billions and billions of dollars go. And we believe strongly that there needs to be more scrutiny on the dollars and where they're being spent. How much of it is going to resident care and how much of it is going to mansions and to bonuses and not to staffing. And once we have transparency on that, we'll know. I think that the sunlight alone will lead to some significant reform. But I think accountability and ownership, figuring out who owns a home and how to get to that information is one thing that I think CMS has promised to do. But I think importantly that there just needs to be more sunlight on how these dollars are spent.
Mm-hmm. Thanks, Sam. Maybe let's take one more question. Does someone have one queued up, ready to go?
Just there seem to be some questions about you know, how much is legislative, how much can CMS get done without the approval from Congress. And one of the things that has really struck us is the amount of proposals here that can be accomplished administratively or through regulations, and don't necessarily, you know, have to go to Congress to get approval. That being said, that there's certainly some things in there. So, for example, one of the proposals is to increase the amount of per instance fines, which currently I think are around 21,000. I believe it's 1 million, that would need congressional approval. But the work on staffing standards, the administration already, CMS already has the authority to do that. So there is, it does seem like the bulk of the proposals are things that can be done through agencies and through regulation.
Thanks, Robin.
Oh, that being said, we will be developing, just so there's both a legislative strategy, obviously, and a regulatory strategy, as well as ways to work to influence guidance and policies. Okay, that's it.
Thanks, Robin. Well, thanks for joining us today. We're coming up to the top of the hour. I'd like to again extend a special thank you to Will Harris from CMS and Christiana Yao, who joined us today. Also, thank you so much to Sam, Jocelyn, and Robin for all of their hard work in not only presenting today, but getting ready for the presentation and the planning that we've been undertaking. And thanks to all of you again for all of the advocacy that you've been doing and continuing to raise your voices. We look forward to continuing to work with you in the coming months, not only for the month of March, as I mentioned, but moving forward, you'll be seeing more with respect to strategies and information and resources that you can use in your advocacy. And we'll be sharing what we'll be doing and look forward to working with you in order to get these really important reforms implemented. So thanks so much. Have a good rest of the day. And you'll be hearing from us starting on Monday. The recording and the materials will be posted to our website as soon as we can get them finalized and up on the site. So thank you so much and enjoy the rest of your week. Bye-bye.